I think advocates knew that this was coming. It happens with Republican administrations. I think those who know Mike Pence expected what happened on January 23rd, which was a presidential memorandum that immediately reinstated the Global Gag Rule as previously applied to that international family planning money, that around $500 million in international family planning money, but then also directed the Secretary of State to expand it to all of global health assistance. That expansion is very, very hard to overstate what that means. The U.S. is the largest global health donor in the world. It is, it's a minuscule, preposterous portion of our budget, but the good it's able to do around the world. We're currently supporting 11.5 million people on ARVs, so HIV treatment worldwide, and providing contraceptive supplies and commodities and counseling and support. I mean, there's a lot of really good work happening, and it is now all touched by the Global Gag Rule. So the White House announced the expansion on January 23rd. The direction was to sort of figure out how far they could take it, essentially. It started applying to international family planning funds in March. That was the sort of the first part of the presidential memorandum. And the expansion and how it would apply to the rest of global health assistance was announced in May. One of the things that makes this a really tricky thing to advocate around and talk about is that it's a contract provision. There's not a big moment where everybody's in or everybody's out, where funding gets slashed, where there's not a big watershed moment for the most part. It is a contract provision that as organizations bid on new U.S. global health money or have new funding moments in their existing contracts or the existing grant agreements, and then it will attach. And that sounds benign. It sounds small. It just sounds like, oh, this is like a contract thing. But what that actually means for an organization is when all of a sudden they are going to have a new dispersal of funds or a new moment in which they are signing something new with the U.S. government, they either are certifying that they no longer or have not or do not, they will comply, and so that they will not provide abortion as a method of family planning, provide counseling and referrals for abortion as a method of family planning, or advocate around abortion as a method of family planning.